So hi everyone. Hello dear students. How are you? So I hope you have gone through the last video that we took some general points about your upcoming exams, right? Prof exams. And so we also took last time the urea cycle, right? And the important points on the urea cycle, right? So today I'm trying to take the questions which are more important, right? And which are more clinical. Okay, so the clinical scenario based questions, right? And the basic point is amino acid metabolism, their products, their disorders. Okay, so amino acids being a very important topic. Okay. Amino acids. So guys, what are the questions that we should know in amino acids? In the amino acids, we should know first thing that is their products. Okay. So we should know the products of amino acids. So they may be helpful in your direct MCQ based question. They may be helpful in your Viva also directly, right? With the multiple questions in Viva, like what are the products of, let's say, arginine, histidine, etc., etc. Okay. So we should know the first thing first, that is products. So let's talk about products. So guys, in the products, if we talk about the first amino acid, let's say that is arginine. Okay, so arginine is very important amino acid because it is making something called as nitric oxide, which is a vasodilator, right? Vasodilator. Nitric oxide, it is acting via cyclic GMP. And guys, we know that arginine, how arginine is converted into nitric oxide, that is through the nitric oxide synthase. Okay, so that is through the nitric oxide synthase enzyme. Okay, now next is, so apart from arginine, we should know histidine. Histidine, histidine decarboxylase. So guys, what's the name of enzyme? Histidine decarboxylase. Guys, remember all the decarboxylases are, okay, all the decarboxylases are vitamin B6 dependent. And all the carboxylases are biotin dependent. Carboxylase, biotin. Decarboxylase B6. Fine. So this is making histamine, right guys? Histamine. Like certain cells in our body, like mast cells, right, which are involved in various allergic reactions, they secrete the histamine. And guys, this histamine sometimes can be released in large quantities apart from some other mediators of allergy, and this may cause anaphylaxis, right? Anaphylaxis is nothing but a severe form of allergic reaction. And guys, histamine is also a vasodilator. So there are two things to remember. It causes allergic reaction and it's a vasodilator, right? So suddenly it can drop the BP, blood pressure. Fine. So that is made from histidine. Guys, histidine is also a very important amino acid. Why? Because it is part of the hemoglobin buffer. So one of the most important amino acid with the buffering capacity at the physiological pH, right? That is histidine. Answer is histidine. Fine. Then the next is, so we have glutamic acid. Guys, glutamic acid, again the decarboxylase, glutamic acid, and D for decarboxylase. And it is converted into GABA. So guys, GABA, what you should know is that it is the inhibitory neurotransmitter, right? Inhibitory and excitatory. So we have the two types of neurotransmitters, inhibitories and excitatories, right? So this is the inhibitory neurotransmitter. Now, if its levels are low, what will happen? Suppose the GABA levels declines. So gamma amino butyric acid. So what will happen? The patient will have, less inhibition to the nervous system. So patient may feel like Anxiety, one of the feature of low GABA can be, let's say, the anxiety. Okay. Anxiety can be one thing, epilepsy, epileptic seizures, etc. That can be the second feature, right? So autism spectrum disorders, there are a lot of things, right? So basically glutamic acid is a very important amino acid which is producing the GABA. GABA is gamma aminobutyric acid. Clear? So guys, these are the two important neurotransmitters. Then we have this is the one important neurotransmitter. Then we have some more neurotransmitters from some different amino acids. So guys, what are the products of, let's say, tyrosine? So when we talk about tyrosine, we have multiple products. So the first product in tyrosine is melanin. Guys, melanin formation, right, requires an enzyme that is called as tyrosinase, which is a copper dependent enzyme, right? So that is why copper deficiency diseases, which are like Menkes disease. You know what is the name of disease in copper deficiency? Menkes, Menke, Menkes disease, right? So there will be less of melanin. Why? Because copper dependent enzymes will become inactive, and this will cause the features of low pigment in the skin, right? Hypopigmentation, we can call it. So melanin is one of the important product of tyrosine. And this deficiency of this tyrosinase enzyme can lead to the disease called as albinism, right? So if there is a deficiency of the enzyme which produces melanin, so name of the enzyme is tyrosinase, and this is copper dependent, I told you. So its deficiency, right, causes what type of disease? And that is called as albinism, right? Albinism. Now, in what other disease, guys, there is a lack of pigment formation in the baby's body, right? Skin. The answer is, can you tell me? Phenylketonuria, right? So that is phenylketonuria. Okay, so tyrosinase deficiency. Now, what is the second product, guys? The second product is thyroid hormones. Okay, thyroid hormones. See the name tyro and thyro. So they are like resembling. So thyroid hormones, you can like remember like that way. So guys, T3 and T4. So how does the T3 and T4 are formed? T3 and T4 are formed by the iodination of the tyrosine residues on the certain proteins which are present in thyroid gland, like thyroglobulin protein. Okay. So iodination of the tyrosine residues. Okay, one, two, three, let's say. So that's let's say that is T3. On a special protein, okay, in the thyroid gland. So that is thyroid hormone is the second product. Any other product that you know, guys, that is called as catecholamines. Okay, catecholamines, okay, like dopamine. Then dopamine is a very important neurotransmitter. Okay, so we have dopamine, then we have norepinephrine, and then we have epinephrine. So as these are the important products of the amino acid, that is tyrosine, that you should know. Okay, so can you name me some more products of amino acids? That is tryptophan. So we have tryptophan. Okay. Tryptophan is a amino acid which is essential. And as tryptophan, aromatic amino acid, it is. And what are the name of the products made by tryptophan? So there are two products, guys, we have. The first is called as again a neurotransmitter, serotonin. So guys, how does the serotonin, what is the other name of serotonin? It is called as the 5-hydroxy tryptamine, right? See, basically, when we start with tryptophan, the first product that is formed is called as 5-hydroxy, okay, tryptamine. Fine, tryptamine. So that is called as serotonin. Okay. So in between there is a formation of some more products, but this is the name of serotonin that you should know. And guys, the second product that is formed is called as melatonin. And guys, to make melatonin from serotonin, right, what we need? We need acetyl CoA and the very important thing that is called as methylation. Okay. So SAM is also required. So if I want to convert serotonin to the melatonin, S for serotonin, M for melatonin. So that is serotonin to melatonin, and this we need acetyl CoA. And what else we need? We need a SAM. Guys, what is SAM? S sulfur, S for the sulfur, A for adenosine, M for methionine. So SAM, that is the methyl donor derived from the special products of methionine, right? SAM. SAM is a methyl donor, methyl group donor. Got my point? So that is called a tryptophan. So guys, tryptophan, these are the two important products that you have to remember. So these are the all the products. So guys, you can get a short note where they can ask you that explain or at least mention the names of the products of various amino acids. This can be a 5 mark question or a 2.5 mark question. If it is a 5 mark question, obviously you have to write even the steps. Like let's say how the catecholamines are formed from the tyrosine. So what are the various steps involved and what are the name of enzymes involved? That you should write. Okay, like to convert dopa to dopamine. Okay, we need the enzyme, let's say, that is called as dopa decarboxylase. Fine. Then from norepinephrine to epinephrine. So like that. Okay, so we have the different enzymes that we should mention. So and if it is just to mention the names, maybe 2.5 mark question or 2 mark question, just mention the names of products and you are done. Now stick to the point. Don't write unnecessary things if it's just a 2 mark question. You got my point, guys? Okay. So that is the basic thing. That is the products of amino acids. Now let's talk about the some disorders, very important disorders, which are commonly asked in your prof exams. Okay, so disorders of amino acids. Now, guys, before we proceed, we should know one thing that disorders of amino acids, or we can also call them, especially the word amino acid ureas, right? So there is no involvement of urea cycle here. It's urea means presence in the urine. So disorders of amino acids or amino acid ureas. So guys, these disorders are not very common, first of all, in the world. Secondly, but they are very deadly disorders. The treatment is very difficult sometimes, and the symptoms may be sometimes very aggressive that cannot be controlled in the later life, right? So that is why, nowadays, doctors, they ask, for the newborn screening of all the babies. Okay. So how to diagnose them before they become like so causing the damage to the body, baby's brain, making them incapable, low IQ, or baby's body, making them crippling disease, cannot move, cannot walk, right? So a lot of symptoms may be there. So there is a term that's called as newborn screening. Okay, newborn screening. So newborn screening simply means what? Screening. Is what is the meaning of screening? Screening simply means I want to find out the disease. It's not visible, right? When you see a patient with some disease, let's say, so even suppose a patient comes to you with a fever, you will see the toxic look on the patient's face that is caused by the fever, right? Okay, the look that is visible, okay, the patient is not fine, some disease is there, but the baby is born very fine. Baby is born happy, right? Smiling, crying, whatever it is, right? So baby was fine and there is no sign of any disease, but you are trying to find out the disease. That is called as screening. You will learn more about screening programs in your PSM, for example. But in India, we don't have much screening programs. But nowadays, as doctors, they're asking for all the newborn screening. All the babies who are born in hospital should be screened for certain disorders which can be dangerous in the future life, like phenylketonuria, maple syrup urine disease, etc. Right? Sorry. So that is called as a newborn screening program. So guys, what we should know here is that we need a machine, we need a technique here, and that is called as tandem mass tandem. Tandem means, when I put two machines together, but the name of actual technology is mass spectrometry. Okay, mass and spectrometry. So that is the name of the, guys, technique of choice. What do you have to write? Technique of choice. Okay. For investigation, screening, and diagnosis. For what? Investigation. I want to do screening. I want to do diagnosis of a particular disease. Okay. What kind of disease? for, for inborn error of metabolism. For all the types of inborn errors of metabolism. What is inborn error of metabolism? When a baby is born with a particular disease, right? Like because of the change in some genes, right? That is called as an inborn error. Like a baby is born with a G6PD deficiency, phenylketonuria, maple syrup, homocystinuria, etc., etc. So that is called as inborn error of metabolism. Got my point, guys? So that is your basic thing first, addition. Guys, for this we can do heel prick. Okay, heel prick sample. So generally in the babies, we don't directly, take the syringe, and take out the blood sample. So we will just, prick the heel of the baby, just prick the heel of the baby and take the sample, take the blood flow and take that blood flow in a special type of filter paper, or, you can also collect that in a tube for the screening, for the testing, right? Okay, so that is nowadays very important, heel prick samples. We can also call them as, guys, dried blood spots. Okay, dried blood spots. So if I take a filter paper kind of thing, and if I take the sample of the baby from the heel, right? So I'm just putting, like multiple places the filter paper and taking the multiple, spots or drops of the blood. Okay, so that is called as a heel prick sample. Okay, so guys, that is a basic knowledge first. And this can be important for again your, let's say, MCQ purpose, right? That you should know. Now, guys, how to, how the questions will be asked in your exams and how you have to write. Now, suppose the question is simple. The question is simple like that. Suppose that you have to write about a disease and the disease is called as homocystinuria. Fine. So how will you approach the question? So the question may be simply like that, that explain the steps of metabolism of methionine. Fine. So that is the one question part of the question. The second part of the question is then explain the disorders of methionine metabolism. That is the second part of the question in a long question. So in the methionine metabolism, we have two questions, right, which we can explain. So one is called as homocystinuria, and another is called as cystinuria, right? Cystinuria. So these two topics you can explain in the methionine metabolism. Fine. So guys, that is really important. First of all, we should know that disease belongs to which amino acid. Sometimes the name is very simple, homocystinuria. So it's a disease of homocysteine metabolism. But homocysteine is not a direct thing that we consume in our body. No? I'm not taking homocysteine in my diet. I am making homocysteine in my body from methionine. So we should know this, that okay, methionine metabolism, yes, and it was a disease, two disease of this pathway, right? So this can be the one way of asking the exam question. That can be a long question, right? Now, the second way of asking the question can be simply like that, that they will give you a case scenario that a young man of 30 years old, right, presented with the chest pain in the hospital, and on, ECG, these were the finding like ST changes, or, on the blood sample, when the blood sample was taken, troponin levels were high. So it's a case of MI. But also at the same time, the levels of homocysteine was very high. That is normal range is given and the higher range is also given, and also the level of cholesterol or total cholesterol or LDL may be high, right? Then they can ask you, the question that, to manage this condition, what are the, you know, what are the drugs or what are the probabilities, that we can manage this patient, okay, so that, the heart attack doesn't happen in the future again. So guys, how will you take this question? Because in your MCQ, in your clinical case scenario question, patient had myocardial infarction. He has also the high level of homocysteine. So guys, as we know, homocysteine levels causes heart attacks. The only amino acid which, if increased in the blood, can cause heart attacks is homocysteine. And this patient also has a high level of LDL. So that can be also a case of, hypercholesterolemia, right? So both the things are mentioned here. So let's take everything separately, okay, and then answer your question. So first talk about homocystinuria and its bad effects, right? Some clinical features. and management, like which vitamin can be given, etc. Then talk about LDL, low density lipoprotein, and then talk about that what causes high LDL concentration, why it is called as a bad cholesterol, why it is causing heart disease. Okay, and what can the treatment like use of statins and which enzyme they're inhibiting, HMG co-reductase, etc. So you can take the questions which have multiple units of your biochemistry together. MI, right? Troponins mentioned. You can mention that CKMB may also increase. CKMB can also increase in MI, right? Troponins can increase in MI. LDH can increase in MI. AST levels can increase in MI. So that is one part is MI. Second part is homocysteine metabolism. You can mention the steps, etc. LDL metabolism, whatever they are asking. So you have such questions also in your exams, which may appear in your prof, right? Which is integration of multiple topics in one question, right? Okay, fine, guys. Now, again, guys, to take the clinical question, whenever there is a clinical question is there in your exams. So what do you have to do? You have to, guys, first thing, you don't have to write any ambiguous things, anything which is, not specific to a particular topic. You don't write them. Right, I told you in the last video also. So just stick to the question. Whatever they're asking, suppose there is a question of 2.5 marks, phenylketonuria, right? So how to approach that question? You should write that, suppose there was a question on phenylketonuria, then you should write that first of all, what is the name of the disease? So name of disease, phenylketonuria. What is the name of deficient enzyme, right? What is the name of deficient enzyme? And then we will come to the clinical features, okay, and highlight them. Highlight every point, like first point, name of disease, second point, third point, clinical features, like what are the clinical features, let's say scissors, let's say hypopigmentation, low IQ. Then number fourth, go to the part of investigation. And guys, in any disease of amino acid or any disease which is inborn error of metabolism like G6PD also, classical galactosemia also, etc. Right? And the disorders of beta oxidation, you can mention that we will do tandem mass spectrometry. Don't forget to mention this. This will give you more marks, right? Tandem and good impression. So tandem mass spectrometry. Fine. Then number five, if possible, always write management. If you know, and if it is in your scope, if it is given in your basic books, like even in Phenylketonuria, every book has mentioned the basic, management in every disease. Like let's say the basic management at first year level, at your level, can be simply restriction of phenylalanine in the diet for lifetime. And second thing you can write addition of certain compounds, let's say tyrosine, which now become essential amino acid because phenylalanine is not converted into tyrosine. So we can supplement that. Okay. So restricted diet of phenylalanine for life, right? And why it is causing low IQ, that you can mention in clinical features. Okay, guys. So let's take some examples and how we can write in the exams. Okay. So some certain disorders of amino acids that we should be able to remember in the exams. So let's write them. Okay. So guys, the first disease. If I talk about the first disease, then it's a disease that is called as the homocystinemia, right? Homocystinemia. So this homocystinemia is a disease of methionine metabolism. So when methionine, we start with the methionine. Methionine first makes a SAM. SAM is a methyl donor in various reactions. That's a separate MCQ you should know. Then SAM converts to homocysteine after releasing the methyl group. Methyl group is removed. Homocysteine, HOC is homocysteine. And homocysteine then, by addition of the amino acid serine, right? And in the presence of enzyme that is called a cystathionine beta synthase. Okay, it is converted into some more steps and then converted into cysteine. So this is a B6 dependent enzyme that is cystathionine beta synthase. Fine. So as in this case, now we have, everything that we should know, right? So first thing, first question that you will be getting is SAM. So you should know about the SAM. So SAM is a methyl donor in converting norepinephrine to epinephrine, serotonin to melatonin. I told you already, serotonin to melatonin. And one more thing that you should know is creatine synthesis, not creatinine, right? I have written wrong here. So it is creatine, okay? Creatine synthesis. So just change it. Creatine. So guys, creatine is made by the three amino acids, that is glycine, arginine, and methionine. And because it's a source of energy, we can remember the mnemonic GAME. Glycine, arginine, methionine. Okay, so that is question number one. Then guys, question number two is obviously we are discussing the topic of homocystinemia or homocystinuria. So this is the disease. First thing I will write is deficient enzyme. So cystathionine beta synthase, right? And I will mention it is B6 dependent because that will also be my treatment. Then I will write the clinical feature. So there's a first clinical feature that you should never miss is the MI or increased risk of cardiovascular diseases. If you know the mechanism, well and good. The guys, one of the mechanism that books mention is that homocysteine, basically convert into certain compounds which causes oxidation of LDL. So basically increased homocysteine, increased oxidized low density lipoprotein or LDL. And this oxidized LDL is taken up by macrophages and they are converted into foam cells. So guys, that is causing atherosclerosis. Okay, atherosclerosis. At your level, at least you should know this. So that is the MI. And there's a second point that you should write in this question is Ectopia lentis. So if you find this word difficult, just read it 2-3 times. Ectopia lentis. It simply means lens of the eye, right? So lens dislocation. Okay, generally it is down, right? Infero nasal. Don't need to remember that. It's okay. Just remember lens dislocation. So guys, the most of the time, young children, they present with vision problems or blurring of the vision, right? Blurred vision. Like the child is unable to see the, suddenly unable to see the uh, blackboard or the screen on the in the school, right? So that is ectopia lentis. Okay. Then there are a lot of other features like long fingers, spider-like fingers. So that is also called as like arachno. You know the word very well, arachnoids. So arachnodactyly. So that is spider-like fingers, fine like that. And stiff joints. Okay, stiff joints. So increased risk of heart disease, ectopia lentis, slender and long limbs and fingers, and stiff joints. So these are the very important features, guys, that we should remember about the homocysteine. So I told you about the investigation. Always mention tandem mass spectroscopy, and there will be increased level of homocysteine. But guys, there will also be increased level of methionine. Why? Because guys, homocysteine convert easily into methionine by the remethylation process. Okay, and this remethylation is done by methylcobalamin and so methyl B12 that I also call this mecobalamin, methylcobalamin, right? That converts into cobalamin. Okay, converts into cobalamin because it has lost its methyl group. So guys, we have given the methyl group, right? Then cobalamin convert back to methylcobalamin. And there's for this again, I need a methyl group. And this methyl group is given by methyl folic acid, THF, which converts now into the free folic acid, THF. So M for methyl folic acid has again given a methyl group Y to convert cobalamin back to the methylcobalamin. So guys, which vitamin deficiency causes folate trap? So deficiency of vitamin B12. Oh, right. Deficiency of vitamin B12 will not allow the use of methylated folic acid. And it will never be able to convert into free folic acid, which is required for DNA, or you can say purines and pyrimidine synthesis. Purines and pyrimidine synthesis, if you see, this requires the role of folic acid directly is there, right? Folic acid is directly involved in purines and pyrimidine synthesis, that is DNA synthesis. And guys, this needs the free folic acid, not the methyl folic acid. So methyl folic acid should be converted into folic acid in the presence of B12. So B12 deficiency causes folate trap. One more question. That is a short question in vitamin section also you can study. Okay, so what is one more question you have to study? That is read again folate trap. Okay, and why the B12 deficiency causes folate trap. Guys, because in your exams, as per the NMC criterias, you will be getting certain questions which are, based on whys, right? Explanation. Okay, why this, why that, why homocysteine, increase in homocysteine causes risk of MI, right? Because one of the reason I told you, like that. So, guys, in the management, what you will be doing? In the management, you will be doing. So, guys, you understand why homocysteine increased because of cystathionine beta synthase enzyme is missing, and why methionine is increased because homocysteine starts converting into methionine, right? Okay. So, guys, in the management, you can give vitamin B6 because it will activate cystathionine beta synthase, guys. But you will give one more thing, that is cysteine supplements. Okay, because now cysteine becomes essential amino acid. What do you call such amino acid which become essential in a disease? Conditionally, we can call this a term that is called as conditionally essential, okay, amino acid. Like in phenylketonuria, it is tyrosine. In this case, it is cysteine becomes essential, right, guys? So this is your management, how you will treat this. Right, guys? So, hope you understood like how we have to approach a clinical question. So, stick to your points like this only. So, first is always the name of disease. Second, deficient enzyme in biochemistry. Clinical feature number three, right? Investigations, that is laboratory test and homocyst and management. So there's laboratory test based questions you can get again in your exams that I told you, like homocysteine was high, troponin was high, LDL was high. So it's a case of MI, which is caused by excess homocysteine in the blood or also excess oxidized LDL in the blood, which may be again caused by homocysteine itself. Isn't it, guys? Okay, so that's your basic management based MCQs that you can, not MCQ, sorry, the questions that you can perform in exams. So if you write like this, section by section, you will get good marks. Huh? Even if you write 2 points in management like this, you will get full marks. Okay. Instead of just writing that, we will avoid a diet which contain homocysteine because there is no such diet. You can write, we can avoid the diet which is rich in methionine. Okay. But don't write like that if you're not sure. So write clearly in the points and keep spaces between each point, like management and investigation should not be continuous. There should be one line separating them. Highlight should be there. You will get better marks. Examiner will try to read your points and your point of view, maybe, right? Then, guys, what is the other disease that we should know in biochemistry exams? We should know about the disease that is called as phenylketonuria. So guys, what happens in this disease? We take phenylalanine, this converts into tyrosine. So what's the name of enzyme? Phenylalanine hydroxylase, as we all know, right? Hydroxylase. And guys, this is taking the help of a coenzyme, BH4. What is the full form? Tetrahydrobiopterin. It is converted into BH2. Right? So BH4 converts into BH2. Okay. So what is the name of the deficient enzyme here? Guys, phenylalanine hydroxylase is the most common. Or what is the other thing that can cause the disease? So this is the most common cause, deficiency of this enzyme. Right? So deficiency of BH4 synthesis. Right? BH4 synthesis, if it is not happening, tetrahydrobiopterin, if it is not synthesized, This can also cause, na, because phenylalanine will accumulate again if BH4 is not there. And that is a cause of PKU, phenylketonuria. So you should write again the deficient enzyme, right? Then guys, coming to the clinical feature. So the first clinical feature you can remember like this, PKU. So guys, PKU, just to remember, like P stands for the pale. Pale simply means hypopigmentation. I'll explain this, hypopigmentation. Check the spelling if it is wrong. So pale, then K for just we can remember like this, crazy, crazy. That is low IQ. Okay, right? In this case, crazy simply means low in IQ. And this urine has abnormal odor. So urine odor, which is musty or mouse like, dead mouse like. Actually it is not dead mouse, but mouse is a term for something which is a odor which is in the areas of high humidity, right? Like for example, the if you go in the basement in the rainy season which was closed for a long time, that particular odor, that's called as a musty or mousy odor, basically, right? So PKU. Now, guys, why there is, you can also explain this, why there is low IQ, because there is a high amount of phenylalanine is there. And guys, this phenylalanine blocks the blood-brain barrier, right? Transporters, okay? Transporters of other amino acids, which are also of the same size. Aromatic amino acid, right? So tryptophan and tyrosine. So guys, what will happen in the brain of the baby? In the brain of the baby, there will be decrease in the tyrosine. So what is a very important neurotransmitter of tyrosine metabolism? Dopamine. So guys, that is why low IQ. Then again, if there is decrease in tryptophan, then there is decrease in serotonin, right? So serotonin levels, if they decrease, what will happen again? In two neurotransmitters, they decrease. So guys, if the two neurotransmitters are decreased, obviously there will be low IQ. So if you explain like this, right, and understand like this, you will get good marks, right? So that is in the brain. Now guys, what are the other features? Other features maybe like scissors or epilepsy may be there. But one of the feature that is, so this was a like first feature, low IQ. The second feature is hypopigmentation. Okay, hypopigmentation. So we see it is not the albinism. It is just decreased in the melanin synthesis. In albinism, there is a complete, most of the time it is when we say is OCA, ocular cutaneous albinism, it is like complete absence of melanin occurs, right? So the patient looks totally white. Okay. So in this case, it is hypopigmentation, fair, excessively fair child. It's not the same, guys. Okay. So in the hyperpigmentation, why is that happening? Guys, because there is decrease in tyrosine now. Phenylalanine is not converted into tyrosine. So obviously tyrosine levels are low. So if it is low, decrease in melanin formation. That's why. So that is the reason, guys, we should remember the products of amino acid. Okay. So we should remember the products of amino acid. So that is hypopigmentation. So then investigation I told you again, tandem mass spectrometry, high phenylalanine levels and low tyrosine levels. So how will you manage this case? So guys, we can manage this case by giving decreased phenylalanine diet or free of phenylalanine for initial few days. Guys, we should call this as a restricted diet. Okay, restricted phenylalanine diet. You know why I'm not saying zero phenylalanine diet. I could have written like this, na? Zero phenylalanine diet, but I cannot write that. You know why? Because phenylalanine is an essential amino acid. We cannot make it zero. So we need to supply that in the diet. If it was some non-essential amino acid, we can make it zero. Hmm? Like if it was glycine, we can make it zero because glycine is a non-essential amino acid, right? So guys, that is also, guys, we can add tyrosine, or you know we can add also the tryptophan, especially 5-hydroxytryptophan. Why? Because it will be absorbed through the blood-brain barrier. It will cross the blood-brain barrier, not absorbed, cross. Right? So we can do that. We can go, guys, we can also add BH4. Okay, BH4 analogs. These are drugs which resembles or which mimics the function of BH4. So we can also add that because BH4 deficiency is also the cause of the this case, that is phenylketonuria. So guys, hope you understood. And guys, diet should be started as soon as possible, because even if it is late by 1 to 2 weeks, it will cause irreversible brain damage, low IQ, less than 50, right? So hope you understood how to approach the clinical questions in exams. Okay guys, what are the other clinical questions that you should read? So I'm just guys, mentioning them. Okay, so that you have to read, okay, properly. So second is, let's say, because we talk about tyrosine. Okay, so in the tyrosine metabolism, we have the two topics. The first is Alkaptonuria. Okay, it is Alkaptonuria. So guys, again in the Alkaptonuria, we have to write, this disease is also called as ochronosis. Guys, Alkaptonuria and ochronosis, these are the two terms which can be used for the same disease. When I say alkaptonuria, it is like, the compounds which are formed, they have a high affinity for alkali. That's why the term came alka. Alka means alkali. So, the homogenetic acid has a high affinity for binding alkalis. That's why. And ochronosis is simply a term that is, pigmentation of the dermal fibers or the, cartilaginous tissues in our body, right? Their pigmentation, and this pigmentation turned them black visibly, but this pigmentation turned them ochre colored. Ochre is like yellowish brown color, ochre colored under the microscope, right? So that is called as ochre colored. That's why the name ochronosis, ochronosis. But in books, we simply see sometimes the word is written because of the blackening of the joints, the blackening of the the cartilaginous areas of body, like sclera, like tip of the nose, like palm, all of them, right? So you should know the deficient enzyme. So deficient enzyme is homogenesic acid oxidase. Okay, and we should know the clinical feature. So what are the clinical features? Blackening plus, urine turns black on standing. What is the meaning of urine turns black on standing? Means if I keep the urine in the test tube for some time in the oxygen, it will turn black. Let's say in 1 to 2 hours. So that is called as standing. Stand, stand that you see in the labs, standing. That's it. So that's the word standing actually. Stand in the lab that you rack, test tube rack. So guys, this is Alkaptonuria or ochronosis, right? Then what is the other disease? And guys, in the treatment investigation, again, I told you, right? The same thing, urine you can write, tandem mass spectroscopy, right? In the management, you can use vitamin C, because vitamin C prevents the conversion of homogenetic acid to benzoquinone acetate, which makes alkapton bodies, which causes the disease of the joints, right? Okay. How does this patient presents with? Hip joint, knee joint, the big joints are involved first, not the small joints. Small joints are not involved in this case. So like spine is involved, the pain in the spine, back pain is one of the earliest feature that you will see. So guys, that is alkaptonuria, ochronosis. What is the other disease that you should know? Tyrosinemia. Okay, tyrosinemia. Right, tyrosinemia. What is the name of enzyme? Deficient fumarate acetoacetate hydrolase. So this is a deficient enzyme, fumarate acetoacetate hydrolase. So guys, in this case, you will mention all the steps of this pathway. And then you will mention the, some clinical feature, then investigation, and then management, right? Everything. Now, guys, in the clinical feature, you will also mention the orders. So, guys, you can get a small question of 2 marks also on the urinary orders. So, guys, what are the various urinary orders? Like in the PKU, it was musty, phenylketonuria. In the tyrosinemia, guys, it is a order which is called as boiled cabbage order in tyrosinemia, this disease. And then there's a maple syrup urine disease. It is the order of burnt sugar, right? Burnt sugar order. So at least you should know, such orders, right? Like this. What are the orders of various disorders? So this is tyrosinemia that you have to read, Alkaptonuria. Then there's in the branch chain amino acids, right? What you have to remember? You have to remember two diseases again, maple syrup urine disease, right? So maple syrup urine disease is the disorder of branch chain amino acid, leucine, isoleucine, and valine. Okay, so these three amino acids. So out of them, guys, leucine is very toxic to the brain, and its metabolites like alpha keto isocaproate, which is made by transamination reaction, that is also very toxic, neurotoxic. So these patients present with like vomiting, seizures, muscle tone problem in the muscle tone, hypotonia, or excessive tone of the muscles, etc. Right? And the urine has an order of maple syrup, that is burnt sugar order, and that is because of isoleucine, guys. You know that. So when you write such points, so that's why we have to read them point by point. So isoleucine causes the order of burnt sugar when it is present in the urine. So or the metabolites of isoleucine, right? So that is maple syrup urine disease. How will you treat this disease? Is to treat this disease again a deficient diet you have to give. Restricted, don't say zero, no, because all the three branch and amino acids are essential. So I will be, in the management, I will be using restricted. This point is more important here for your exams because clinical feature sometimes may not be specific. Like in PKU there was something specific like low IQ, but here it is may have multiple features, you may not remember much, but then these points become very important. That do you know the names of branched amino acids? Do you know that name of investigation is tandem mass spectroscopy? Restricted diet, so restricted leucine, isoleucine, valine in the diet you have to give. Okay, guys. So that is very important to remember. Management. So maple syrup urine disease. And guys, then there are certain disorders like a disease that is called as methyl malonic acid urea. Right? Methylmalonic aciduria. So methylmalonic aciduria is a disease which is caused by the deficiency of the enzyme that is called as methylmalonyl coenzyme A mutase. And guys, it is B12 dependent. So even in the B12 deficiency, there is a methylmalonic aciduria. So as this methylmalonic acid, this appears in the urine or this may accumulate in the blood and causes acidosis. So guys, where do you find this name? You know, when I talk about isoleucine and valine, their metabolism also makes something called as propionyl coenzyme A. Do you know that propionyl coenzyme A, three carbon compound, and isoleucine valine, not leucine, isoleucine and valine metabolism, but also the odd chain fat metabolism, if you remember, odd chain fatty acid oxidation, that is beta oxidation, that is also making propionyl CoA, and then propionyl CoA converts into methyl malonyl coenzyme A, and then methyl malonyl coenzyme A converts to succinyl coenzyme A by this enzyme which is deficient in this disease, this enzyme mutase. So succinyl CoA then goes to the Krebs cycle. Okay, this will go to the Krebs cycle. So guys, this is an enzyme which is B12 dependent. So now let's come to the B12. So guys, in the B12 deficiency, there will be megaloblastic anemia. But apart from that, if you mention this line, right, definitely in vitamins, I'll tell you this, that in B12 deficiency, there will be also increased levels of methylmalonic acid. Okay, so that is also diagnostic. And there is also one more thing I will tell you today. When you have to differentiate between B12 deficiency and folate deficiency. So sometimes it is difficult. You know why? Because the patient presents with a disease that is called as megaloblastic anemia, which is a disease where the DNA synthesis suffers. Like the nucleus will be small in the early phases of RBC synthesis, but the cell will be large, megaloblast, bigger cells, smaller nucleus. So why the nucleus is not forming? Because folate is deficient. Okay, I told you folic acid has a role directly in making purines and pyrimidines. Just look at the pathway. Purines and pyrimidine synthesis cannot happen without folic acid. But B12 is important to make folic acid free. I told you now, methyl THF to THF, I need B12. So obviously, if there is no B12, there is a folate deficiency called as folate trap. So both the disease present with the same points. Huh? Also, guys, we discuss homocystinuria. So there is increase in homocysteine because homocysteine to methionine conversion needs B12 and folic acid both. So here also increase in homocysteine. Then how to identify? You can say vegan patient, purely vegetarian patient is B12 deficient. Yes, maybe. But guys, that's the best answer is increased in methylmalonic acid. Here it is not. So this line, this line is the most important point to differentiate between B12 and folic acid deficiency. So as how will you deficient biochemically B12 and folic acid deficiency? By just looking at these parameters, homocysteine and methylmalonic acid. So homocysteine plus methylmalonic acid both high. If they're both high, it's B12. If only homocysteine high, but methylmalonic acid is not high, it is folic acid deficiency. Correct, guys? So these are the disorders. What else? Other disorders which are not commonly asked in prof exams, right? One of them may be cystinuria. So guys, I would suggest at least go through it, basics, and Hartnupp's disease. The Hartnup disease may be important, in the tryptophan metabolism. Guys, because a Hartnupp's disease patient presents with pellagra-like disease, pellagra-like dermatitis. Pellagra-like dermatitis. You got a point? So that is Hartnupp's disease. In Hartnupp's disease, there is defective neutral amino acid transporters in the kidney and the intestine. In cystinuria, there is a basic amino acid transporter. यहाँ पे है basic amino acid transporter defects. यहाँ पे neutral amino acid transporter defects. Clear? And guys, when we write Hartnupp's, we can also remember like this: HARTNUP. So where the P stands for pellagra-like dermatitis and for neutral amino acid urea, that is like tryptophan in the urine. And because guys, tryptophan is the only amino acid which makes niacin. So decrease in the tryptophan, why decrease? Because it is passed in the urine. So that means decrease in niacin also. And because of decrease in niacin, there is pellagra-like dermatitis. You got my point? Again, Hartnupp's disease, defective neutral amino acid transporter. So neutral amino acid will not be absorbed and they will appear in the urine also. So less tryptophan means less niacin formed. Less niacin formed means pellagra-like disease like Castle's necklace may appear, right? So that is neutral amino acid urea, and there is remember TR for tryptophan because T stands for tyrosine, threonine, etc. So this is TR now together. So just to remember, make it like tryptophan disease is Hartnupp's disease. It's not threonine, not TH now, not threonine, not tyrosine, not T by here. So guys, that is the basic of all the important, you know, diseases that you should know in terms of the amino acid metabolism. Most commonly in exams, still I will tell you that the PKU and homocystinuria and Alkaptonuria. These three are the most common questions in the prof exams that you'll be getting. Right? Phenylketonuria, homocystinuria, and Alkaptonuria. These three are the most important questions with high probability to appear in your prof exams. Right? But obviously we are preparing here for MBBS exams. You're going to be a doctor. You can't leave anything untouched, right? So you should have the knowledge of each and every topic, right? May not be in very details, but yes, but these topics you should know in details. Fine. Chalo guys, thank you so much. And I'll not take you much time. So keep revising and when you revise again and again, you feel the confidence in your mind, right? Because if you leave them unfinished, you will always feel that, something is being missing, right? You'll not feel the confidence. Okay, so keep revising. So don't stop until you are finished. Huh? And don't stop when you are tired, right? Stop when you are finished. So keep revising these topics. Biochemistry is very easy and very small compared to your other subjects. So you can score good here easily. Just need a revision because it's sometime volatile. Okay, guys, bye bye. Good night. Okay.
Done, sir. Thank you, sir.
Okay.
Recording stopped.